Hey all, hello and welcome to ShareTreck. My name is Raj, and I bet that if you're not one of our subscribers, you chanced upon this video while searching for information on genomics as it relates to your decision to make some investments in this field. In this channel, I focus on genomics talks, and in today's video, which is part one of a two-part series, I'm going to be discussing about some of the things that you need to know as a genomic investor. Let's ask this question. Can cancer and inherited genetic disease be cured? I'll be answering this question from the point of view of a genomics investor in this video, and I'll be sharing all the information I've gathered in order to be a better genomics investor so that you don't have to duplicate my efforts. So if you're interested, please continue watching. Let's get started. Welcome back. Recently, a Nobel Prize was awarded to Jennifer Doudna and Emmanuel Charpentier for the discovery of CRISPR-Cas9, which is a molecule that allows to edit the DNA at a chosen location. Since then, scientists and genomic startups have invested a lot of research to come up with more refined and precise methods to edit the DNA. Editing the DNA allows to impart special characteristics to cells. It also allows to correct genetic defects and cure many inherited genetic disorders like sickle cell anemia. The list of genetic disorders that can be cured is only going to increase as the scientists keep on discovering the genetic defects or mutation that cause those disorders, because now we have editing tools in our hand. And that's the power of investing in the genomics area, because the scope is wide and the kind of cures that are coming in from this sector are going to be way superior to the current medicines that we have. And that's the premise of being a genomics investor. CRISPR-Cas9 is a basic DNA editing system, and it results in double-strand breaks that are subsequently repaired, and the necessary edit is completed. Some of the recent developments include modifying a T cell so that it can search and hunt for tumors and cancer and destroy the tumor and cancer cells. Those are called CAR T cell therapies. And also we have another couple of techniques which are able to make edits on the DNA without doing a double-strand break. This uses a kind of deactivated Cas9 protein. We have base editing and prime editing that edit one of the strands of the DNA and perform corrections without double-strand breaks. The difference between base editing and prime editing is that prime editing offers more editing opportunities than base editing, and that's why it's a more superior and more precise tool for certain applications. Now, in this video, we'll try to understand CAR T therapy from an investor's perspective. In the next video, I'm going to be talking about base editing, prime editing, and their differences. And in today's video, some of the key points that you need to understand are being laid out first. The first point that we need to understand is that T cells are a key part of our human immune system. T cells focus on specific foreign particles and do not generally attack any antigens. T cells circulate until they encounter their specific antigens, at which point they latch onto the antigen and destroy it. It is possible to engineer T cells to target a very specific antigen. They are given chimeric receptors to target the antigen and become a CAR T cell. And this is done by editing the genes and inserting new gene material into the T cell and multiplying them so that they are chimeric T cells or CAR T cells, and then put back into the body of the patient. CAR T cell therapies currently approved by FDA to date target one of two antigens on B cells. They are CD19 or BCMA. Now more about the popular CD19. CD19, the full form is cluster of differentiation 19. We don't need to know this as investors, but this is just a nice to know little bit of extra information. CD19 is also expressed as a subset of acute myelogenous leukemias. CD19 is one of the most reliable surface biomarkers for B lymphocytes. CD19 counts may be useful to screen for disorder. So CD19 is a very, very important antigen, and elevated CD19 is seen in B cell lymphomas and in autoimmune disease. Now, about the famous BCMA. BCMA stands for B cell maturation antigen. Again, as a genomics investor, you don't need to know this. It's a nice to know information. The overexpression and activation of BCMA are associated with progression of multiple myelomas. BCMA is heavily present on myeloma cells and only minimally present on other cells, such as stem cells. This means that BCMA-targeted therapy could help slow the growth of myeloma since it begins in the B cells. Also, BCMA can make for a useful marker in monitoring the response to therapy in people with multiple myeloma. A 2021 case report from trusted source followed two people with refractory multiple myeloma. Both had received anti-BCMA CAR T cell therapy, and researchers found that within 30 days, the participants had a complete response to treatment, which means that all signs of cancers disappeared. At 4 and 10 months, respectively, the complete response persisted, and follow-up at 36 months showed that there were still no signs of cancer. Here, I would like to show you a diagram that shows the entire CAR T cell therapy. Let's start with this diagram here. Step 1 is when the clinicians take blood cells from the patient and harvest T cells from there. And then the second step is in the lab, where a specific gene is inserted into the T cells, and the T cells start growing what is called as chimeric receptors, which are these prong-like appendages that come out of the T cell. That's the conceptual representation of a CAR T cell. And these receptors are programmed to target either CD19 or BCMA or CD7 or a specific antigen that is supposed to be contained only in the type of cells that is sought to be destroyed. In our case, it's going to be cancer cells. So typically, it's going to be CD19 or BCMA or CD7. And once those chimeric receptors are developed, then the lab continues to multiply the CAR T cells and grows millions of them, and then transfuses that back into the patient. And the step 5 is when the CAR T cells start moving all over the body of the patients in the bloodstream, hunting for the antigen that it is designed to track and latch onto and destroy. So as soon as it encounters the antigen, let us say in this case it is CD19 or BCMA, it will release cytokines. Cytokines are specific enzymes that will kill cancer cells, that will kill the cell that contains a specific antigen. During this treatment process in the initial stages, there will be a lot of cytokines released into the bloodstream of the patient, and the patient will therefore have side effects, and that needs to be monitored. So hospitalization takes place. But at the end of the process, the patient is typically clear of cancer. Now, I would like to show you another diagram, which is my own handiwork, which further simplifies the entire CAR T cell concept. So as you can see here in my diagram, I have a simple T cell conceptually represented as the circle out here. It's a T cell, and it is edited. And during the editing, a specific gene is inserted into it so that the T cell can now form what is called as chimeric antigen receptor. So these prong-like appendages that you see here are the conceptual representation of chimeric antigen receptor. So the cells which have got chimeric antigen receptors are called as CAR T cells, where CAR stands for chimeric antigen receptor. And these CAR T cells are programmed to be targeting a specific antigen. It could be CD19, BCMA, or CD7, or any antigen that is present predominantly in the cells that have been sought to be found and destroyed. So this is how I would represent the CAR T cell concept for a basic investor. As CAR T cells multiply, they release large amounts of chemicals called cytokines into the blood. This leads to serious side effects. Such side effects include headaches, tremors, fever, weakness, chills, and loss of appetite. These are all momentary side effects to the best of my knowledge. Earlier, I had read that cytokine release due to CAR T cell therapy stresses the kidneys. However, the National Library of Medicine has articles that confirm that cytokine release does not cause kidney injury. CAR T cell success rate is about 30 to 40% for lasting remissions. As you can see in this table out here, there are 6 approved CAR T therapies already in the market. 4 of them target CD19 and 2 of them target BCMA. You can see that Novartis has got Chimera, which is an autologous treatment. In an autologous treatment, what happens is we take blood from the patient and the T cells are harvested from there, modified, and put back into the body exactly as we saw in the chart that we discussed a moment ago. All the therapies so far in the market for CAR T are autologous. And the other 2 CAR T therapies targeting CD19 are from Gilead, and 2 more from Bristol Myers Squibb, and 1 from Johnson & Johnson. So these are already approved and they're already in the market, and all these treatments are somewhere in the range of around $400,000 to $450,000. So that's the price range at which these therapies go. And the list below, which is the table below, which you can see out here, is basically from companies that are in our watch list. All of these are genomic startup companies. The first one is CRISPR Therapeutics. It has got CTX110 in clinical trials. It's targeting CD19. CTX112 is also in clinical trials. It is targeting CD19. It's in the IND-enabling stage. CTX130 is targeting CD17, and it's in clinical trials. And Beam Therapeutics has got a Beam 201, which is targeting CD7, which is an allogenic approach. In an allogenic approach, T cells are harvested from a healthy individual, and then it is modified in order to give it chimeric receptors. And on top of that, there is also modification done so that it can handle the immune response from the human body when it's introduced into the human body, and also some inhibitors that can prevent the CAR T cells from being killed off or prolong the life of the CAR T cell within the body. So those modifications are done in case of the allogenic therapies. So Beam has got Beam 201, which is targeting CD7. This has been put into hold for the time being. I'm confident that Beam will be able to provide necessary information to FDA, and the hold will be lifted soon. Allogene has got two CD19 CAR T therapies in the phase 1 clinical trial, and it has got three BCMA targeting allogenic therapies in phase 1 clinical trial, and Intellia has got Intellia NTLA 5000 in early stage clinical trial enrolling patients. So this is the lay of the land when it comes to CAR T therapies that are being currently proposed by genomic startup companies in our watch list here that are with the FDA. And some of these are closer to approval than the others, but the allogenic approach seems to be much better from an investment perspective. So let me explain that concept to you. In case of autologous therapy, what happens is that you need an infrastructure to extract the T cells from the patient. And that becomes an extra cost, and that becomes an extra logistics problem, both in terms of time, location, commuting, etc., and also transporting the materials. Now, the other problem with the autologous approach is that the time duration that it takes from harvesting the T cells from the patient to processing it, multiplying it, and introducing it back to the patient. That's also a more time-consuming situation. And also, if the patient is very weak from previous treatments, you have to allow a certain period of time for the patient to get into a proper state where you can harvest the T cells. So those are all the constraints. But on the positive side, because the T cells come from the same patient, immune response is not a big problem because the patient's body recognizes the T cell as being part of the body. Whereas if you go to the allogenic approach, the advantage you have is that an allogenic therapy can be dispensed just like any other therapy that is being currently sold in the market, because you don't need to extract the T cells from the patient. So a healthy donor can give T cells at any point of time, and it can be manufactured to be given the chimeric antigen receptor and stored readily available off the counter to be given to a patient. So that introduces a lot of economy of scale and production, and reduces a lot of logistics and time constraints that you find in the autologous approach. So from an investment perspective, allogenic approach, if successful, seems to be much more attractive than the autologous, given that the pricing capacity will remain the same. Now, the second advantage for allogenic approach is, of course, transportation, the ease of availability, and ability to dispense. All of this becomes much easier. So that's the second advantage. However, there's a big disadvantage when it comes to allogenic approach. It's the immune system from the body. And of late, many companies have come up with a lot of genetic additions within the CAR T cells in order to give them the power to evade the immune systems in the body, in the human body, that try to kill foreign objects, because these CAR T cells would have come from a donor. So a lot of headway has been made in order to prolong the life of the CAR T cell within the human body so that it can continue searching for the very last of the antigens in the body and destroy the very last of the cancer cells and the tumor cells that it's targeting. And so far, the results have been encouraging. I'd like to, at this point of time, show you a video that one of our subscribers sent to me. This talks about therapy from Caribou Biosciences. And I'd like you to watch this clip, and I'll talk to you at the other end of the clip.
Of pain was normal for what he thought was a hernia, but his wife Tamison thought otherwise.
I said, John, that's not right.
After seeing a doctor,
They told us it was non-Hodgkin's lymphoma.
We cried for 3 days when I found out I had cancer. And I told her, I said, that's enough.
John went through chemotherapy and went into remission.
And by the 12th month, it was back with a vengeance.
And that pattern continued for close to a decade.
What we're doing now with John is a quantum leap forward.
Until OHC's Dr. Jim Essel stepped in.
He had 8 different treatment courses over 9 years. So the T cells are exhausted. They don't fight cancer as well, which is why we thought he would be a perfect candidate for this clinical trial.
Dr. Essel and his team at OHC were approached by Caribou Biosciences to participate in a phase 1 trial for a more targeted approach to treating B-cell non-Hodgkin lymphoma.
It can specifically insert an antibody directed against cancer into these T cells. Then the T cells hone in on cancer cells. They release chemicals that cause the cells to divide, bring more T cells in, and ultimately kill the cancer.
And in June of last year, he was the first in the world to receive this cutting-edge cancer treatment.
It didn't hit me at all until I had my test, and it come back that my cancer's shrinking and shrinking and shrinking. All my doctors, nurses, they took care of me like a newborn baby. And we laugh. It's like a big family here.
The only way we make this ground-breaking improvement is bold, courageous people like John that are willing to take the risk and being the first one ever to get this treatment.
After just 28 days after that treatment, John showed no detectable signs of cancer, and he stayed that way since. Dr. Essel says soon they'll move on to the next phase of the trial to treat even more people.
Well, friends, now it's time to summarize everything, because you have seen the video, and before that I had explained a whole lot of things, so things would have got a bit hazy. Instead of having to rewind, here's a quick summary. So what we need to know is that CRISPR-Cas9 was the very first gene editing system that became very popular and easy to use. There were other methods before, but they were a bit cumbersome. So that's point number 1. CRISPR-Cas9 requires double-stranded breaks, and then after the DNA is broken, it heals itself. That's the way CRISPR-Cas9 works. Whereas the scientists and genomic startups have been doing a lot of research since the CRISPR-Cas9 molecule was discovered, and they came up with a new method of treating cancers and tumors, and that was to modify a human T cell and provide it chimeric antigen receptors, which enable the T cell to hunt for a specific antigen in the human body, and the antigen that it is programmed to hunt is usually the antigen that is present in cancer cells or tumor cells, and therefore the T cell zeroes in on the exact antigen within the body and finds the exact cell and destroys the cell by releasing cytokines and kills the cells. And this is how CAR T cell therapy works. And then we also have what is called as base editing and prime editing, where double strand breaks do not happen. Instead of that, just individual alphabets in the DNA are modified, and therefore genetic defects or mistakes can be corrected, and the underlying disease or syndrome can be treated. So that's how base and prime editing work. I would like to talk more about base and prime editing in my next video. So I would strongly encourage you to subscribe to the channel and also press the notification button so that you get to know as soon as I release the video, which should be coming in another week or 10 days time. So please watch out for that. Having said that, I have to remind you of one more thing, that there are 2 ways of delivering CAR T therapy to the human body. One is the autologous method, the other is the allogenic method. In the autologous method, T cells from the body of the patient is taken, modified, given chimeric antigen receptors, and put back into the patient's body. In an allogenic approach, a healthy donor provides a T cell, which is modified, in order to provide chimeric antigen receptors to it. And it's also modified in order to be able to evade the immune system of the body so that it can last longer in the human body. And it's available off the shelf, so there is no lead time between the patient requiring the treatment and the CAR T cells being available. Whereas in a autologous method, we need to have the patient to be healthy enough to donate the CAR T cells, so there will be a certain delay involved in that. And then the CAR T cells donated by the patient is likely to be less healthy because the patient is weak. So that is the second problem out there. And the third problem is the entire logistics of scheduling to collect the CAR T cells, transporting it to the lab, getting it all properly edited, multiplied, and put back into the patient's body. The whole logistics cycle becomes expanded. Whereas with the allogenic therapy, it's off the shelf and it's easy to administer, and the lead time is very short. So from an investor perspective, allogenic approach seems to be much more profitable as well as optimum in its delivery as compared to the autologous method. However, the fact remains that at this point of time, all the CAR T therapies that have been approved by FDA have been autologous therapies. That is basically because the autologous approach uses the patient's own T cells. Therefore, the need to do immune suppression is reduced. And that's the major benefit of the autologous therapies. More and more companies, startup companies in the genomic sector, are developing allogenic approach. As you saw in our spreadsheet, there are at least 6 allogenic CAR T therapies that are in the FDA clinical trial stage with genomic startups. It's just a matter of time before one of them succeeds, and that's going to further revolutionize the genomic medicine scene. This field is only going to grow further, and if you're an investor, you cannot afford to overlook the genomic investment field. So I hope you would subscribe to our channel and watch our videos and get to learn more about investment opportunities in this field. With that said, if you like this video, I'd request you to press the like button so that YouTube can expose this video to more people like yourself. And also, if you have not yet subscribed, please subscribe and press the notify button so that you get to know whenever I put up a new video like this. Thanks and have a great day. Bye for now.